Dr. Samreen, welcome. So today we're here at the NBT conference in Houston, and you were one of the co-chairs. And I think we'd like to start with just, what is NBT, next big thing? What is SAGES trying to accomplish with this conference, and what should we be looking forward to?
Yeah, so first of all, thank you for having me, and thank you for coming down to NBT. Next big thing under the umbrella of SAGES has different components. I'm co-chairing the SDTS part of it, and I think the biggest thing here is that we are trying to bring industry and surgeons speaking the same language on the table next to each other. So this is unlike any other conference. We are on purpose not keeping the content CME driven, because we want to be able to have frank conversations with industry. So it brings surgeons and industry at the table at the same time to talk the same language.
As you're planning this conference, how do you determine what the next big thing is going to be?
It's driven a lot by people who are part of the conference. So as the pre-work for the conference, we ask the board to put in their suggestions, and then there's actually a survey that goes out to a lot of people who we want to ask, what are the topics they're interested in? What is the next big thing that they think they want to hear about, and the tech side of it? And then what are the pain points? What are things that they want more of in the operating room or less of, from innovation, surgical AI, medtech innovation, a lot of that stuff. And so the content gets driven by what people are wanting to see.
For some surgeons, some medical professionals, anytime industry is involved, they assume bias. How do you make sure to keep the bias out of the system as you're trying to create this, we'll say, collegial atmosphere that you're trying to produce here?
I don't think the goal is to keep bias out. The goal is to allow conversation. Lack of conversation is what brings bias. And so I think it's pretty amazing how this conference achieves having a lot of industry players at the same time on the same table as surgeons. So we're not claiming that we're bias-free. We're just claiming that we're allowing conversations, and it's okay to have those frank conversations.
I have to say, with our platform, I've definitely seen that having various industry players in the same room sometimes causes, let's say, conflict. Do you ever find any issues with your conference in terms of industry players not getting along, or any of the groups, or everybody seems to kind of let bygones be bygones for a few days? Is that how this plays out?
I think everyone knows everyone else closely in industry, so it's hard to create an environment that is not collegial, because these are the same people you're going to see again and again. So we haven't found problems. We've only seen new ideas come out of it, and more positive relationships being formed rather than the other side of it.
Just for a minute, I want you to put on your clinical surgery hat. Your background is foregut?
And bariatrics.
And bariatrics. What is your thought on the GLP-1 inhibitors? Where does that fit in the current algorithm for bariatrics?
We don't stop people from taking their aspirin if we do a stent on them. So I think it's another tool in the toolbox. We can't be against GLP-1s. It's definitely, for the right patient, it's the right choice. But that also doesn't mean that bariatric surgery is not relevant anymore. I think it's combined therapy. This is actually an exciting time for physicians and for surgeons and for patients, for everyone, because now we have more than one way of treating a disease which gets so much negativity, so much bias. Patients suffer for so long. So there has to be a wide variety of options to take care of our patients, and combination therapy is probably the future.
As I say, I think that some would argue that the GLP-1s are the next big thing in medicine, and everybody's talking about them. And also, I would say that the other big, I think, focus probably you're going to see at this conference is robotics, correct? So where do you see, I mean, we have, of course, robotics has taken over a significant portion of our operative procedures. Where do you see that going in the future?
minimally invasive surgery is what needs to happen more often than not. Even today in North America, most operations are being done open. And none of us would want surgery done open on us. So anything that facilitates minimally invasive surgery, no matter which robot that is, I think that's overall a positive. Now, of course, we have to be very careful. There are cost restraints, there are safety concerns. First and foremost, it has to be safe for patients. We have to maintain quality in healthcare. But we also, while we do that, I think robotic surgery is a positive. It helps. The word I would use here, and I will take some liberty to use the word democratizing surgery, because operations that only a few could do before, minimally invasive. So a very great example of that is inguinal hernia repairs. I think robotics has made it much more commonplace for people to get minimally invasive inguinal hernia repair rather than an open one. So robotics is overall a great thing. We just need to have more players in the market.
I don't know if Intuitive would agree with you on that, but I definitely hear you. No, it's exciting. I think this conference is amazing, and I'm glad that we finally have an opportunity to really show off to the rest of the general surgery community and other surgeons just what you accomplished here. It's going to be exciting to hear what all the industry has to say and create that interaction that just doesn't exist anywhere else. So I applaud you for what you've done, and thank you so much for joining us on The Cutting Edge.
Thank you so much, and we're very excited.
Imagine a platform that connects you directly to a private group of surgical colleagues. Within the app, you interact socially with colleagues, post your own surgical videos, scan the library for relevant content by type of surgical procedure, anatomy, or even specific operative step. You'll be invited to live webinars and build your network through conferences hosted on the app, all while maintaining your privacy. SurgeOn, where surgeons go to explore, discover, and learn.
Time spent charting is time away from patient care. That's why we created SurgeOn Scribe. With one click, generate complete SOAP notes and save 6 minutes per patient. That can add up to saving 2 hours every day. No more late nights documenting. With a simple setup and customizable templates, you're ready to go in minutes. Start your free trial today and transform your workflow. SurgeOn Scribe, because your time matters.
Dr. Wilson, welcome.
Thank you. It's an honor to be here.
So we're here in Houston for SAGES NBT, and you are one of the directors, correct?
Yes, it's a complicated backstory, but I'll try to explain it very quickly. The next big thing, or SAGES NBT, was an effort to try to bring more innovation into SAGES, and it has several components. It has an AI component. It has something called NoSCAR, which is an interluminal component, and then the Surgical Disruptive Technology Summit is the part that I play aggressively in. And so the Surgical Disruptive Technology Summit is in its 10th year. So it's been around even before NBT was around, and we usually had it every year in Houston. So this is our 10th annual one, and it's a collaboration between industry, surgeons, and physicians around what's going to change and happen in surgery in the next 5 to 10 years. And it's really focused on soft tissue abdominal, thoracic surgery, and those subspecialties. But there are other specialties that come into play. And the whole mission of it was to look differently at what an educational meeting was set up to be. And SAGES felt this really fit in with their next big thing idea, so they wanted to incorporate it. And we've done that like 5 years ago. The idea behind the Surgical Disruptive Technology Summit is to create a meeting where industry wasn't just supporting the meeting with funds, but actually getting up on stage and talking about their own opinions and biases. So this is a meeting that's really kind of focused on, we're all adults here. Let's get our biases out and talk about why we think something's good or great and what we think is going to happen with the future of surgery, and just discuss it and see if we can challenge each other to see if we can learn how to be more embracive of innovative ideas, devices, procedures, but also really think about where we need to be flexing going forward when we think about abdominal surgery, soft tissue surgery, laparoscopy, endoscopy, robotics. So it's a 2-day meeting that starts tomorrow. It's very, very intense. It's in one room. It's very fast-paced. A lot of speakers get up on stage and go back and present in a panel discussion format, and we move along very quickly. There's no other room. It's only one room. It's usually between 200 and 300 people, and we try to keep it relatively small and very discussive. So lots of panel discussions. You'll see that people will often get up there and they'll only have like a minute or two to say something. So I have to say something pretty profound or dramatic in that short period of time, trying to be provocative, and then we have a discussion about it. So some of the talks are as short as a minute and a half. Some of them go up to 7 to 10 minutes, but there's very few talks that are 20, 30, 40 minutes. That doesn't really exist in this format. So it's a very fast-paced format. The whole idea is to get everybody in the same room so we can learn from other specialties, learn from different industries. Industries can learn from the surgeons. And hopefully by the end of 2 days, everyone's brain will hurt a little bit. That's the goal.
What do you see as the big conversations that are going to occur? And do you see any animosity between the sides, or do you feel that it's a very congenial, collegial discussion?
Well, we try to create a little bit of drama, but not really debates. I think the surgeons and the gastroenterologists are really good about just giving their opinion. We've worked harder to get industry to be more vocal about their opinion. So the formats are set up to, express your opinion directly, and then let's have a discussion or a conversation about it. I think it feels very collaborative. We do have some discussions that could be full-fledged debates, but we really don't want to try to go that way to say my technology is better than your technology. It's more about, can this drive things forward, and how is it going to drive things forward? But we do it in a way where we're talking more about concepts as opposed to directly comparing technologies. So when you have, like, for example, different robotics companies talking, we're not going to say, well, why is your robot better than your robot? We're just going to say, what do you think the value propositions of your robot that allow some uniqueness to the market, and where could those potentially make a good role for us to utilize that technology, in what locations, by what physicians, what specialties, and things of that nature. So we keep it more conceptual, so everyone will get up on stage and be willing to talk, but try not to make it competitive.
It sounds like it's going to be a really fun conference. It's going to be a lot of learning, especially on the technology side. Real quick before we go, could you just define digital surgery? It's something that's come up a couple of times. People have asked me, like, how do you define that?
That's a great question. I think it's some form of software or computer between us and the patient that hopefully makes us safer, more efficient, improves the value proposition of what we're doing in the operating room. That would be my favorite definition of digital surgery. When robotics came online, I was an early adopter in like 2002, 2003, and I think it was because I just happened to have it available to me, so I was kind of lucky in that road. But once I started down that process, I was like, even though this has lots of limitations, the original robotic platforms that were out there, I just don't see how we're not going to put a computer between us and the patient, because all the things we can measure and how it can augment and improve what we offer our patients. And that's what digital surgery is really doing, I think. And I think that's happening on the hardware side. I think it's on the software side as well. And we have to be actively engaged in that process, or we're not going to be measuring and trying to improve the right things for our patients and for us to have long careers. I think we need to utilize digital surgery so we can optimize patient care, also not stifle creativity, but improve variability at the same time, and those things can be challenging against each other, so we have to work together on that. But the main thing is the providers have to be a player at the table, and so hopefully formats like this allow us to understand how important that is, and then participate and work directly with these companies to make sure the right questions and the right processes are really helping our patients.
I think what you've done here is amazing. I think the interface between the tech companies, the device companies, and surgeons, and getting the engineers in the same room. I think that really is exciting. So thank you so much for all your work as a fellow surgeon. I'm looking forward to the next couple of days, and I appreciate your time.
Well, I really appreciate it. Thanks for interviewing me, and it's great to be here.
Imagine a platform that connects you directly to a private group of surgical colleagues. Within the app, you interact socially with colleagues, post your own surgical videos, scan the library for relevant content by type of surgical procedure, anatomy, or even specific operative step. You'll be invited to live webinars and build your network through conferences hosted on the app, all while maintaining your privacy. SurgeOn, where surgeons go to explore, discover, and learn.
Time spent charting is time away from patient care. That's why we created SurgeOn Scribe. With one click, generate complete SOAP notes and save 6 minutes per patient. That can add up to saving 2 hours every day. No more late nights documenting. With a simple setup and customizable templates, you're ready to go in minutes. Start your free trial today and transform your workflow. SurgeOn Scribe, because your time matters.
So, Dr. Munday, welcome.
Thank you.
So we're here at NBT in Houston, and of course NBT's next big thing, and apparently you have a new device, EndoSpool, that you've developed.
Yes, sir.
You could just kind of walk us through, what is this?
In its most basic form, it's a suture management device. Over the years, I've gone out and proctored for Intuitive, watched a lot of surgeons struggle to learn the robotic system, and I've just watched and learned how inefficient people can be with their suture management. I also see it in my own cases. I see that's a time that I spend a lot of time wasting where I could move along through the case, and there's also some benefits of patient safety as well.
So walk me through, well, how does it work exactly?
So it's a injection molded device that suture can either be pre-wound on or could be wound at bedside. Once the suture's in the clamshell device, the bedside assistant puts it into the operative field either on a laparoscopic instrument driver or on one of the robotic arms. And then the surgeon can actually feed the suture off of it directly as they operate. So it cuts down on what I call the ball of spaghetti you get when you're doing a ventral hernia.
So is it just one suture you're putting in, or is it multiple you put in?
It's one at a time, but part of the beauty of it is you can use a longer suture than you normally would. Some people, to get around this issue of suture management, they put 4, 5, 6 small sutures in, and that exposes the patient's abdomen to a lot of needles.
Agree. And it's small enough to get in through a 8-port?
Yes, it fits through an 8mm trocar, and it's about 60 millimeters long. It can hold over 18 inches of suture. You can wind 30 inches on it, but they don't make barbed that long yet. So
barbed sutures are fine. And
you can use barbed suture.
PDS,
you could use silk, PDS. You could use Gore-Tex if you wanted to.
And the needles aren't a problem either. Size of needle doesn't matter.
Whatever will fit down the trocar. The needle actually sits out of the carriage as it comes in.
Yeah. And my understanding is community surgeon.
Yes, sir.
And this is not your first invention, correct?
Actually, it is.
Oh, really?
Yes.
So. But you have other, is it patents or?
Well, there's a whole portfolio of patents around this device.
Gotcha.
And actually the first thing I started to try to design was something to help close fascia and to use in a robotic setting. Part of that device with the fascial closure needed a suture carriage. So then I developed a suture carriage. I got patents on it. I went out to companies. They didn't really seem interested to put their suture on at first. Some of it was COVID and the things in the economy that were going on with that. But I realized I needed something that if the suture companies weren't interested in, that they could do it at bedside and the surgeon can use it even if a company wasn't interested. So it forced me to do a few iterations to get what we have today.
So when did this all start?
2017.
So yeah, so we're 8 years into it now.
Yes, sir.
And as a surgeon out in the community doing his thing, what would you say you've learned from this process, from I always say a wisdom standpoint, that somebody can't just teach it, but you had to actually experience?
Well, so perseverance is a big key because you hear a lot of no's before you'll hear your yes. Also the timeline. When I first started applying for patents, I had no idea it would take 3 years before I could get one granted. So I thought it would be like we would get one issued, and then I could go to the companies and market it, and then that would be it. But it's been a lot longer pipeline than I ever dreamed.
Yeah, I went through the patent process myself, and it's one of those, you think it's a really cool thing, they'll submit it, government will get back to you, and then I almost forgot about it. It's like years go by, I was like, all of a sudden you get this letter, it's like, oh, I have a patent now.
Yeah.
And yeah, it is definitely longer than people think.
Yes.
And in terms of dealing with the companies, did you learn anything in those interactions?
I learned that they're kind of hard to get to executives. You talk to a lot of people, and then even through COVID, it seems like a lot of executives change around. So you talk to one person and you reach back to them 6 months, a year later, and they may not even work for that company anymore. So I've had that happen a couple times.
Yeah, no, we were running that when we were creating Surgeon. We had a company, a very large company, and we thought we had an agreement with them. And then we reached back out, and their entire executive team had been removed, and we had to start all over again from scratch. And I agree with you. Trying to find your way to the top of the companies, or to anybody that can make real decisions, can be quite difficult.
Yes.
And you spend a lot of time talking to, I say, middle management and being told things, and you find out down the road that they really could make a decision, or you're just kind of stuck in an empty spin cycle.
Yes.
So, but even then, how does somebody get a hold of one of these if they want to?
Well, so right now I have prototypes. I don't have FDA clearance yet. Part of it is the manufacturing part is a piece I don't have. To go through the FDA, I need to have sterile manufacturing and this sort of thing. So that's kind of my next step. Hopefully we can find a partner in industry that sees the value in it, and then maybe it'll be on the market at that point. But it's either going to be find a partner in industry or find a way to go directly to market myself. The problem with the second option is I still want to be a workaday surgeon. I love what I do. I love taking care of patients, so I don't really want to give that up for industry.
And so if somebody's watching this and they say, look, I think it's a good idea, and they reach out to you, you want to hear from investors or hear from people that are in it, other surgeons maybe? Or
I'm open to partnership. I'm open to licensing, any of that.
And do you have any surgeons you work with that have also tried it? Or
We're just a small community. This isn't something I'm in a small group in a small town, so it's not something I really talk about with a lot of people. I think my parents know about it, my wife, and a few of my mentors at the University of Louisville, and that's about it. So, and part of it, when I'm going through the patent process, I didn't really understand when it would be safe to talk about things. This fall, we've expanded and gotten our patents granted in the EU, so we've already got United States, Canada, Australia, Japan, and then 6 countries in the EU. So
really?
Yes.
That's an extensive number of patents that you have already secured. Well, all that being said, if somebody wants to reach out, we're going to be on Surgeon. They can reach out to you on Surgeon. Is there any other way you'd like them to reach out to you?
Email's fine.
All right. Like I said, we'll look for you on Surgeon, and thank you so much for your time here on The Cutting Edge.
Thank you.
Thank you.